Hi everyone, my name is Kayla, and for this presentation, I will be speaking on fall prevention. So just a little bit of a background. The beginning of this semester, before we picked our practice problem, my department had dealt with a serious safety event, which included the fall. So when this came up, I saw it as a prime opportunity to establish a connection between my school and my work. So, for an introduction to this fall issue, approximately 700,000 to 1 million patient falls occur annually within hospitals. It is also stated that these falls result in around 250,000 injuries per year. Falls amongst the elderly population are a high risk of reoccurring injury and readmission. To address the challenge posed by fall incidents in acute care settings, comprehensive fall prevention programs should be implemented. These programs should include multidisciplinary measures such as staff education, fall bundle utilization, and regular risk assessments. The fall bundle application would consist of bed fall monitors and patient monitoring systems, as well as the basic fall prevention methods that we do with most every patient, such as keeping the bed in the lowest locked position, placing the call light within reach, and maintaining a clutter-free environment. For the significance of the problem, falls remain a common and costly issue within acute care settings. Upwards of 30% of hospital falls result in physical injury. These falls can result in prolonged hospital stays, increased healthcare costs, and even death in severe cases. The average age of falls occurs in individuals 65 and older, with an estimated 1 in 3 in this age group will fall, compared to 1 in 2 aged 80 and older who will fall within 1 year time frame. Falls in acute care settings can be costly to both the patient and the hospital system. An estimated $35,475 and $36,776 are attributed to falls and fall-related injuries inside an acute care facility. Preventative measures such as fall risk assessments and the implementation of safety protocols are essential for decreasing the number of falls and hospitalized patients. My PICO question. In patients identified as high risk for falls due to prior incidences, existing medical conditions, or specific procedures, how does the implementation of an enhanced fall prevention bundle, including fall monitors, patient monitoring systems, and patient education, compared to standard fall prevention measures such as ensuring the call light is within reach and keeping the bed in the lowest locked position in terms of reducing the number of falls during their hospital stay? Search strategy and results. I used the online databases with the university as well as Google Scholar, things like EBSCO or PubMed. I used keywords like fall risk, falls in acute care settings, fall bundles, fall injuries, and things of that nature. Results. Journal articles found supporting the need for multidisciplinary approaches in care for high-risk fall patients, and a journal finding that a deeper integration of physical therapy was critical to fall patients to support safe independence. The author of this made a point that nursing staff, physical therapy, and occupational therapy play a pivotal role in helping patients not only regain independence, but do so safely. For literature support, as seen here, was the comparison of the articles to find common themes. The level of evidence for this research problem is focused on meta-analysis and quantitative research articles. Statistical evidence is required for this problem. It is imperative to gain evidence to support the further research into fall prevention strategies, as falls create a significant number of injuries yearly. There was strong agreement that multidisciplinary teams provide an advantage in preventing falls among high-risk individuals. The discussion also included advanced monitoring systems such as Avisure and artificial intelligence coded solutions that offer continuous patient observation when staff may not be present. While this constant monitoring is beneficial, it is important to note that these systems cannot stop a patient from falling or provide real-time alerts beyond triggering alarms or notifying the nurse's station. Therefore, these systems should be viewed not as a definitive fall prevention intervention, but rather as supplementary alarms aimed at reducing the risks of falls. The setting for my proposed change are acute care settings such as emergency departments, inpatient units, and surgical units. Implementing these changes into an acute care setting using Coder's process for leading change. We first establish a sense of urgency, which would involve sharing data on current fall rates and the impact of falls on patient outcomes to highlight the need for immediate action. And to go back to the beginning, the sense of urgency for my department was the serious safety event that occurred with a patient due to a fall. Forming a guiding coalition would include assembling an interdisciplinary team of nurses, physicians, and quality improvement staff to champion the initiative. The next step would be create a clear vision, reducing falls by consistently applying evidence-based fall prevention bundles. Communicating this vision would require frequent staff meetings, educational sessions, and visible reminders about the new protocols. Empowering others might involve providing staff with training, resources, and the authority to make real-time decisions about fall prevention practices. Short-term wins would be celebrated by recognizing units that achieve reduction in fall rates after implementing these changes. Consolidating gains would mean analyzing results, refining the bundles, what's needed in these bundles, in the application of them, and expanding successful strategies to other units. And then finally, anchoring these changes into the work environment culture would involve incorporating fall prevention bundles into ongoing staff education, policies, and performance evaluations to ensure long-term sustainability and continuous improvement into patient safety. Through my research for this practice question, I found that applying advanced techniques such as enhanced monitoring systems and patient education appears to make patients feel more inclined to follow safety instructions when they're able to follow safety instructions, of course. A big part of fall prevention in able-minded patients is education. Teach-back methods involve patients in their decisions and help reduce risk-taking behaviors, such as a post-op patient getting up by themselves and therefore may fall because of medications given during a procedure. The effectiveness of advanced fall bundles can be measured by tracking changes in the number of patient falls before and after their implementation. By systematically recording fall rates in both periods and directly comparing outcomes using a statistical test such as a chi-square test for proportions, healthcare providers can quantify the reduction in falls and demonstrate the impact of these interventions on patient safety and quality of care. For the data collection for this practice problem would be independent logs kept on secure drives, typically with the facility at which it's being held, to keep confidentiality. These logs would include the MRN, the Morse fall score, fall bundle application, if it wasn't, and any fall during their admission. The goal would be to follow these high-risk patients during their admission to see if they fell, and if they did fall, what made them fall. Were they given a medication? Were they on the bed alarm when they should have been? Were they seen as not a fall risk and then all of a sudden had some form of unexpected event? These things would be logged and then followed probably over a course of a year, 6 months to a year, to see what was working well and what was not working well. Plan for dissemination. Important stakeholders such as nurse aides, nurses, physicians, nurse managers, and physical therapy, etc., included to learn and implement applying these bundles more frequently and working together collaboratively for the betterment of the patient. The evaluation would hopefully find that there was a reduction in falls in that hospital system. There was an article published in the Healthcare Risk Management that discusses a Tampa, Florida hospital that had achieved an 80% reduction in falls over the course of a year. This hospital system used various methods such as boot camps to train staff, encouraging staff to create fall prevention plans, and the use of quarterly report cards to help motivate staff. In conclusion, by implementing advanced fall prevention bundles that incorporate specialized monitoring systems and target patient education, healthcare providers can reduce the number of falls among high risk patients. The findings indicate that a multidisciplinary approach, which includes staff education and ongoing risk assessments, is crucial for the successful implementation of prevention strategies. Personalizing fall interventions based on the individual patient needs, particularly for those with prior fall incidents or medical conditions, enhances the effectiveness of fall prevention measures. Ultimately, increasing awareness and practically addressing fall risks not only improves patient safety, but also contributes to the overall efficiency of patient care. And this last slide is the references I used for this presentation. Thank you.